Now, Dr. Lawrence, you probably have a similar problem of getting parents involved. Let me ask you that question, but then also double down by asking maybe a related question. Say a child comes to one of the teachers within the school and say, I think I have a problem, and is asking for an intervention. What can the school, the teacher, the district do with that kind of information?
I'll answer that question. First, what I'd like to share with you is one of the things that we're so very mindful of as a school community is, by and large, friends and families come to each other's homes. So as much as Stacy and everyone is so accurate to say we need to rid things from our homes, it's not even just so much me as a parent for my children, but I think we all would like to have that house where our friends of our children come and hang out. And if you have prescription pain medication in your house, it's not even so much your children are at risk of taking it, but your children's friends. So indirectly, please be mindful of that. It's not just your children, it's everybody's children. We host many family evenings, whether it's the 9th grade orientation. A couple of years ago, we had a suicide, and we hosted a family night. And the audience, by and large, is an empty audience. So we continue to reach out to families, whether it's in newsletters, whether it's administration, whether it's guidance counselors. More and more we have health teachers that are playing a critical role in answering questions for students that go above and beyond what the state curriculum would be, but pride themselves on making decent, strong, candid relationships with children, and will have some very sensitive conversations. Our guidance counselors are doing the same thing. When children come to our health teachers, when they come to guidance counselors, when they come to administrators, we're very sensitive that we're there to educate the whole child. We also recognize that we have limitations. Unfortunately, some conversations, very important ones with children, the first adult to have that conversation is a teacher or a guidance counselor or a principal, and that's difficult. What we are willing to do and what we do is children come. They can come in confidence. They can come with one, they can come with others. We have very skilled nurses, guidance counselors, health professionals, administration, who will answer questions for them. We've done a lot to embark on collaborations. We're looking to ensure that if a child and a family needs to be in touch with either a medical professional or a guidance counselor or some service provider, that we're able to work collaboratively and make that happen in a week. We've worked diligently to make that happen, and we're one of a few communities that can make that happen. What happens, unfortunately, sometimes in schools is that if it is, and when it does become a legal issue, by and large, our hands are tied. If a child has been arrested, really our conversation is over. And where we start to begin to work is with that family to transition them back into the schools. If they're in a different setting, to work with that family to have conversations to assist them with dealing with the issue and also transitioning back to schools. We do as much as we can to promote. We do as much as we can to publicize. But besides going around with the big yellow school bus and picking up the families, there's not much we can do.
Dr. Updike and Dr. Jadok, perhaps after Dr. Updike, a whole series of questions in terms of what are some of the manifestations, early manifestations of addiction? Are there any things that parents, teachers, we in law enforcement, pharmacy people could see or appreciate that we perhaps don't? Are there any sorts of rules of thumb for routine post-surgery prescriptions? Should we as parents say that there should never be more than 10 pills? Or could you just perhaps explicate that from an addiction specialist point of view?
Sure. Well, it's a complicated question. I would say for everybody, the earliest manifestations of addiction are going to be subtle. For children, though, for kids, it's going to be a change in kind of the usual behavior. Mm-hmm. So one of the slides I put up there, you really couldn't see it so well, but that's one of the real risk factors is they start not doing very well in school. One of the real common things I've seen is like these kids who are athletes, they drop out of the sports teams. It's a behavioral manifestations. This is a chronic disease, not like diabetes where I could measure your sugar. The symptoms are behavioral. So it's basically behavior that's abnormal. Most people are going to be hiding that behavior initially. And so that's why you have to be suspicious and kind of look for the signs. In adults, it's going to be work-related, family-related problems, From a physician's perspective, pretty much every time I hear someone lost their prescription, there's a problem. You know, prescriptions don't just walk out of vehicles, for instance. Those kinds of, really, if you sort of think about it, really, your prescription just fell out of your purse, or really you had your whole month's supply of medication in your car. Those kinds of things that just really don't make sense. Nowadays we have to be suspicious of those types of things. And again, unfortunately, I will say, us doctors, we're usually the last ones to know. Everybody else knows what's going on. We're the doctors prescribing the medication, and the family's saying, well, listen, unfortunately, the family doesn't always say this. Well, listen, this and this and this has happened. He's on the couch asleep all day. He lost his job, that kind of thing, these behavioral manifestations, and not till it really gets out of control sometimes do we really recognize what's going on. As far as acute pain management, that's a very difficult area. The opiates are really, again, the primary treatment for any kind of acute related pain issues. At least from the medical literature standpoint, when we look at risks of addiction, when you expose, so to speak, a patient who has a really legitimate acute pain need, the risk of that patient becoming addicted is very small. Now, does that mean that never happens? No. Should there be limitations on the amount of medicines prescribed? I think rationally, yes. From a pharmacy perspective, I think that's a very difficult thing to do. I will say, as a physician, it's a lot of work. I say, well, rather than see you back every couple of days, I'm going to give you a 2-week supply. But this is where we are now, and we have to deal with the reality. And from my perspective, it is much more appropriate to give just a smaller amount and see someone back than to give too much of an amount and potentially have troubles in the ways that we've been describing.
Dr. Jadok?
Well, as a healthcare professional, physicians, pharmacists, we want to make sure we're treating the right patients. If the patients obviously need pain management, we want to make sure they have it. One of the things we've talked about earlier today, previous speakers, is the access to a database where the pharmacist can see doctor shopping. And as much as insurance companies do cover pain medications as well, a lot of times the tip-off are cash customers. They're coming in with cash because then there's no paper trail back or an electronic trail back to their insurers and such. And this legislation, the iStop program, would certainly help pharmacists have some of the tools that we need to be helping in the monitoring process. So if you see a profile where a patient now they've gotten Lortabs at 6 different pharmacies within the last week, you certainly have the opportunity to call the physician and say, look, if you didn't realize this, this is what we're facing, or is there some legitimate reason for this?
Dale, thank you. During your presentation, you mentioned that you get leads all the time from all different ways. Is there a process or a procedure by which information can remain confidential? Say a concern somebody may have that somebody is actually dealing drugs. What sorts of assurances can you give people who do share information like that their name won't be exposed? And Tim, also, could you perhaps describe to the audience after Dale, what would you do with confidential information? Is it of any use at all to you as a prosecutor? And maybe just a little bit as to how or who you decide to prosecute and for what. Because in our office, as you know, we don't prosecute users of drugs, seldom anybody under 18. Perhaps if you can address those specifics. But Dale, you first.
Well, Bill, information to help start cases for us, criminal cases, comes from a variety of sources. And if someone calls our office and has some information about a drug trafficker, for the most part, that information that we receive, we'll keep that source confidential, provided that we don't have to use that source to make a purchase of narcotics, an undercover purchase. There are exceptions to that, however. Some of our best cases are not made by anonymous phone calls or people that just call in with information. Some of our best cases are made by cooperating defendants, people that we've worked the case on that is now cooperating because they don't want to go to jail. And unfortunately, in those situations, that person, whether it's a male or female, does not have the option of not testifying. Testifying in court is part of the process for them to get credit for their cooperation. So, you know, in those circumstances, you know, the identity of the person is going to be known eventually. Those are our best cases, but we take everything and anything. I mean, we received a tip call, an anonymous tip call yesterday on a particular case. Agents ran out and pursued it and ended up seizing about $90,000 in cash from a drug trafficker. So what you're describing happens often, and we do act upon every single thing that we get.
Tim?
Yeah, and I'd second Dale's thoughts on a couple of things. One, when we get this confidential information in, the agents bring it to us. Obviously, could be the predication for us opening an investigation, beginning a grand jury investigation, which could result in the issuance of grand jury subpoenas to obtain further information about whether it be a pharmacy or a doctor or whatever, phone records. So that type of information as it comes in is very important, not only to the investigative agency, but to the law enforcement prosecutor, who ultimately has to compile enough evidence, because that's what we deal with. We need evidence to bring a criminal case against someone, something that will stand up in court. So that, even if it's information and that's all we get, that can be very useful for us. As far as our decision making with respect to who we're going to charge, we don't have the manpower like the local agencies or even the setup within the court system to handle the number of individuals who might just merely possess narcotics, the users of narcotics, not the sellers of narcotics. So we really take a fine line and examine the cases that Dale Kasperzak's agents bring to us, and we're really looking for large-scale prescription pill traffickers. Although I will tell you that because of the epidemic in our region, we have taken a broader view of obviously the number of cases we'll take in the prescription pill area. It is a high priority of our division, so we'll continue to investigate all those cases and identify the individuals who are trafficking the narcotics.
Thank you, Tim. And perhaps in just a limited number of minutes we have left, if we could begin with Dale. In 30 seconds or less, and then we'll work through the rest of our panel, what one thing do you want to share with this audience that it should be a takeaway from today's program? And then we'll continue on with Dr. Updike and so on.
You know, 30 seconds is tough for me. But I will tell you this. Cooperation amongst all of the different disciplines here is the biggest way or the best way that we're going to be able to defeat this problem. We in law enforcement really, we're reaching out to everybody here to work together. The partnership has been beneficial, and I think we're beginning to see some good results.
Mm-hmm. Paul?
Okay, for me, I guess I'd say a call to my colleagues, physicians, that we need to educate ourselves. It's been a particular interest of mine for some time, and it is really my hope that a forum such as this will get us all on the same page. I agree with what Mr. Lynch has said. We have to raise the bar for ourselves. I mean, me speaking as a physician, that we really could do a better job, and I think the time for excuses has passed that way. And that is really my hope for that. That's the takeaway I'd like to have everyone think.
Dr. Milan?
Well, I would echo what Dr. Updike said, and I think from my perspective, within Independent Health as an organization, we support all of the efforts around educating the physician community. We're, as I've said, in a kind of a unique position of being able to provide information around prescribing patterns that I think sometimes can be an eye-opener to physicians themselves about their own prescribing patterns, and also can provide information around what's going on with their own patients that is often information that they don't know. We support lots of those educational efforts for physicians so that they can develop increased expertise around how to use these narcotics and identify patients that may become problematic or at risk of becoming addicted, so that we can eventually minimize some of the problems that have been so prevalent and in some cases so very heartbreaking that we've heard today.
Bill?
From my perspective, it's advocacy. If you could please take another look at what was presented here today in regards to the real-time prescription monitoring system, and they call it iStop. And call your lawmakers, call your representatives both on the Assembly and the Senate side, and advocate for that, and let them know how important this is in our community. And second to that is, also remember what was said earlier about no detox services for our children. Our adults have services that can go into any hospital-based or any freestanding detox unit and detox from narcotics. We don't have that for our kids here in New York State. And please, if you could advocate for that, it would be very, very helpful.
Stacy?
At the end of the day, this is a disease about people. It's about the Israels, it's about Sam, it's about the doctor. It's about all of us who have kids and loved ones that struggle with the disease of addiction. So I hope that everyone were to go forward from today, because we're all a part of the solution. It's not just the people up here, it's not just law enforcement, it's the medical community. We all hold a piece of that responsibility, and I hope that for the people that this is affecting, the faces of the people you saw today, this will just be the start of a very long dialogue.
Frank?
I don't know what to do. I think what I'd want everybody here to take away is that once all of these national drug collection events go away, when everything walks away, I'm still going to be here. I'm still going to be here helping get rid of these things out of your households. If you're law enforcement and you're in Erie County, come talk to me. I will help you set up a collection event. I'm more than happy to. We could have you guys do one every weekend, and I can meet you in Niagara Falls every Monday. I'm more than happy. I'll be out of my office. And if you don't live in Erie, if you're not Erie County, contact Dale. I can help you do the paperwork. I can teach you what needs to be done. I can bring you up to speed on the laws that you need to maintain, and I can get you the contacts at Covanta so you can get rid of these things. I'm more than happy to help. I started this for the environmental reasons, but I'm doing it for the people like Samantha.
Dr. Jadon?
To piggyback on what Frank said is, we can minimize the problem. We have to tackle this from every possible front, and to piggyback on what Stacy said, the call to action is not just the people here, it's for everyone here. If you're in a position of authority, a position in your community, get the word out. I mean, when we were planning this meeting, we want this to be the start of something, the start to take it out into the community and to have it multiply exponentially, because that's how we're going to tackle the problem. As a faculty member at the pharmacy school, certainly, my plans are to talk about corresponding liability and as pharmacists and healthcare professionals to help solve these problems, and look forward to programs like iStop. And from a legislative standpoint, we're looking to improve the system. Perhaps we won't need these drug drop-offs on a regular basis. We'll have something more permanent in place and able to take them back to pharmacies or drop them off at law enforcement or whatever the case may be, or at the county environmental department. Thank you.
Thank you. Dr. Lawrence?
25% of teenagers have taken prescription pain medication for recreational use. It is not a school problem. It is a school age problem. I beg you, I encourage you, please become active involved in the schools in your community. We're doing everything we can. We're doing everything we can to raise a whole child. Support your public schools, support your private schools.
And AUSA Lynch.
Two things. One, I think if we all had doctors like Dr. Updike, we probably wouldn't have as severe a problem as we have. He's obviously conscientious, he's caring. But the second person, who may not know it yet, but I think Samantha probably is going to be the one who changes the most lives. She doesn't realize it, but she'll go forward, meet people, talk to people, help people. I think that's going to be a big difference, because I've seen it, and you have it, and you don't think it'll change lives, but it will, because I know it does. My dad's changed
a lot of lives, and he still does it 25 years later. So you'll do it too. And you don't forget that. You're a very important part of this entire solution. I want you to know that.
Thank you very much.